little bit about what is Gainswave and what does it do and how does it work. Well, when I was in private practice, as every urologist is trained, when someone came in with erectile dysfunction, we offered them the standard things that we had been trained in residency. First thing we offered was something like Viagra or Cialis. We then offered either something like a penile pump, a medicine called Muse, which is a caplet that you put in the urethra and causes vasodilation and erections, penile injections, where they would give themselves a shot to get an erection, or penile prosthesis, which is surgically implanted. Nowhere in my training did I ever learn about anything that actually reversed the underlying disease process. And we know that erectile dysfunction, 90% of the time, it is cardiovascular disease and lack of robust blood flow to the penis. So what options do we now have available that actually address treating the vessels? Well, I did a lot of research on this, and the first thing that I learned about was the P-shot, and then the next thing that I learned about was Gainswave. So let's talk about Gainswave first, because I think that is, if done in isolation, is probably the better of the two. It uses low intensity acoustic waves, or shock waves. Those waves, as they penetrate through the penis and affect the arteries in the penis, it causes them to break up the microplaque in the arteries, which makes the blood vessels more elastic and healthier. It also stimulates something called neoangiogenesis, which is new blood vessels. So the combination of healthier vessels combined with new blood vessels, we get more robust blood flow into the penis, which gives you a firmer, harder erection that will last longer. We believe with Gainswave that we like to address the entire cycle of the erection. So one of the things that I'll ask you is if you've had a testosterone level checked. It's not the whole enchilada, but a normal testosterone level is very important when treating erectile dysfunction. And we can check that for you if you've not already had it checked. And oftentimes we can boost your natural testosterone level with some supplements. We then look at the whole cycle. When you decide you want to have an erection, there has to be a way that your brain communicates to your penis to get an erection. And the way that it does that is with the nerves. So the nerves release something called nitric oxide. Nitric oxide I think of as the on switch. So it tells the arteries to dilate. PDE5, on the other hand, is the off switch. That's where Viagra became famous. So we learned that if we blocked PDE5, then we had higher levels of nitric oxide and we could sustain an erection longer. We also now know that nitric oxide levels drop naturally with age. It's about 10% per decade. So let's say you're 60 years old. You have about 40% of the natural nitric oxide levels that you had when you were 20. The good news is we can boost nitric oxide levels with a supplement, simply just taking a vitamin every day. Then we want to address the health of the blood vessels. That's where Gainswave comes in with the low acoustic shockwave therapy. That breaks up the microplaque in the arteries so that that can get reabsorbed and the arteries become more elastic and more healthy. It also stimulates the neoangiogenesis, which I mentioned is the new blood vessels. The next piece of the puzzle is PDE5. Instead of taking 100 milligrams of Viagra on the days that you want to have intercourse, we believe you should promote good blood flow to the penis 24 hours a day. So we put you on a low-dose sildenafil, which is the generic version of Viagra and much less expensive than Viagra, and we have you take that every day like a vitamin. The final piece of the puzzle is the use it or lose it principle applies with erections. Just like if you go to the gym 5 days a week, every week, you're going to be in much better shape than if you just go once a month. Well, the same is true with your penis. When you were 20, your body exercised your penis fairly robustly while you were sleeping. Those are those nocturnal erections. We also tended to be a little bit more sexually active when we're in our 20s and 30s than we tend to be in our 50s, 60s, and later in life. But that affects the penis. If you're not using it, it becomes less healthy. So during therapy, we want you to get 2 good erections every day that last for 5 minutes. It's unrealistic to expect you to have intercourse twice a day. So what we do is we give you a pump so that you can exercise the penis twice a day during therapy. The combination of all of these things is what gives Gainswaves its good results. Actually, they're excellent results. There's very specific protocols, and anybody that is Gainswave provider adheres to those protocols so that you can expect uniform results no matter which Gainswave provider you go to. We are really hoping that if this is of interest to you, that you'll give us a call, and the consultation with me is completely free. I hope to see you soon.